Hi everybody, thanks for joining me. Happy Monday, SuperSoul Boulder. Welcome. My name's Lara Johnson, Dr. Lara Johnson from Yellow Brick Physical Therapy, and welcome to SuperSoul Boulder, where we talk about everything mind, body, heart, health, and wellness. Hey Dan, great to see you. And what does that mean? That means even though professionally, most of my experience is with the body. Hi Carlos, oh my gosh, I'm so glad to see you guys. Is with the body through exercise science and physical therapy. I'm also super interested in, bonjour, hey Danny, in why it's so important to care for our bodies, why it's so important to take good care of it, because it houses our mind and what we think and act and believe and all those things, and also our heart, our spirit, our soul, all the things that make us, all the things that make you uniquely you. Hi Alan, great to see you. So some of you saw my post earlier. Oh my gosh, how this creativity has been coming out of me, and it's a little vulnerable to share in that way. So thank you so much for your awesome receptivity to that and my rhyming and all these things. So today's topic, I was thinking about this, how we need to have a strong spine and a soft belly. So we could say that in different ways, right? A strong back and a soft front. Earlier today, I mentioned the core, so that can trip people up sometimes, especially in our health and fitness and physical therapy world. Hey, Mike, because we tend to think of it in certain ways and think we need to do X, Y, and Z. And we're not just talking about the physicality, that's part of it, we'll talk about that. We're also talking about, the inner core, your true core, and what that means, what that entails, what that embodies. So it's both, right? You know how I love a good physical and body metaphor for life. So that's what we're talking about. So we need a strong back and a soft front. What does that mean? Last week we talked about alignment, and through all my experience clinically, especially with people with back and spine issues, I specialize in neuromuscular physical therapy. I'm nerve focused, which means we gotta start with the nerve, and that allows the muscles to function properly, which allows the joints to have freedom of movement, freedom of posture, and all of those things. And so what that means is we want to have that spine strong and articulated in that healthy alignment we talked about last time, right? If you missed the episode, you can check it out on my feed, on my Facebook feed, or on YouTube. But we want that healthy alignment of the spine, right? So here's our physical part of this. So the healthy alignment of the spine, it means you have those natural normal curvatures. We also need flexibility on the front. Now I'll add this, the core, the way we all think about it is the whole encompassing left, right, front, and back. That's all really important. It includes our upper legs. But what I want to talk about is really the muscles that attach to the back side of your lumbar spine and the muscles that attach to the front side of the lumbar spine. And so it's not so much about having hardness or hard back, but the spine's kind of like that. It's a protective feel. If you feel the bones of your spine, those vertebrae, those are protective. So your spine protects this really, really important piece of anatomy called your spinal cord. And your spinal cord, I hadn't thought about bringing this up, but your spinal cord, carries the signals from your brain down through the spinal cord and branches out through these nerves that control all the muscles in your body that send all the sensation back up to your brain. But the spinal cord is so important. Great examples of this, or if we have a spinal cord injury, heaven forbid, we end up with paralysis and either sensory deficits or motor deficits. And so nerves do both, and the cord is really important because then we lose everything below where that injury happens. But back to this, so it's really important that the vertebral column houses and protects the spinal cord in that protective structure. Like our structure, right? The skeleton is protective. The rib cage protects all these vital organs inside of it. So it's protective on the back, especially for the spinal cord, which again controls all the muscles, especially in here. The spinal cord and the nerves that branch out from it control all the muscles in your low back, front and back, and down your legs all the way to your feet. And so we need that to be strong and protective. And then we need the front side to be receptive, softer, vulnerable. And what happens for a lot of us, it happened for me too, my athletic pursuits had me strengthen and get strong and protective on the front, right? Which makes me, this motion makes me think of, okay, we can brace ourselves and, receive the punches of life that could come at us. And I see this a lot of times in patients. Not only are we tight and kind of rigid and restricted in the muscles on the front side that attach to the spine and attach to the legs, and then pull our postures forward, make us in that slouched walker position that we don't want to get into. No. We want to be nice and tall and upright and have those freedom of motion in our hips and in our spine. So without that length, we slouch and get into these postures that restrict other joints, restrict nerves here, and then create all these other hosts of problems biomechanically, neurologically, muscularly. And so we want to have this, so that protectiveness, again, so I see that in patients both muscularly and, oftentimes we just have a protective reflex to brace there. So emotionally, it's very normal, it is very common to also be bracing because of some of the things we've experienced in life. So how often for you are you both dealing with the structure, the physicality of that bracing and the tension that happens because of everything going on in life? Our history, our past, our upbringing, our conditioning, all the things that make us want to protect ourselves make sense. There are vital organs in here too. There are important things going on. However, one thing I've discovered and found over time, both in the clinic and personally, is that knowing that the spine is strong and stable, especially if we can keep some flexibility in the front. This is important because the spine is a spring load. It needs to be like a slinky. It needs to move so we can absorb forces. The discs in between the vertebrae, are those cushions, those intervertebral discs, those are your biggest shock absorbers of the spine. If we clamp everything down and shut it down, then all we're left with is this clamp on the front, clamp on the back, compression on the spine. This leads to disc herniations and disc ruptures and disc degeneration over time. It leads to pinched nerves, and then people go on down the road of surgery. Please don't do that. Take it as the last resort and try to prevent yourself from going down that road. But that compression on the spine leads to more rigidity and stiffness, not just the spine back. Think spine front, spinal stabilizer, psoas and iliacus, attached to each vertebrae and its disc and down, attaching to the leg, and pull on you forward. Why do they pull on you forward? Because we sit and shorten them. And we walk and run and work them and shorten, swimming, biking, everything's shortening. How often do you do movements backward compared to all the movements you do frontward? So we need that length and pliability on the front side to have full range of motion, full function, full access. And then secondarily, we need some receptivity to life. Oh, Danny, yeah. That's something I explain to patients all the time, but not always on here on SuperSoul. But yeah, it makes sense, right? Like we move forward all the time, and we gotta have it can be shortened and pulled forward, and it's a really common and simple thing to focus on to keep ourselves healthy. Yep, that slinky. Our spine's like a spring load. It's like a slinky. When we compress it, it's like pretend that slinky is compressed down and then bending forward because of all our movements forward, and then it compresses on the discs on that front side. There's not an even weight distribution, and then we wind up with all these other like wear and tear in the disc, and then that causes herniations and ruptures and all that not good stuff that you want to avoid. Those are the bigger problems. So we want to handle the problems while they're small, not bigger. So that length on the front side becomes very important, because remember, and I'll get back to the other point in a second, in order to have full alignment, like we talked about last week, right? This alignment where you're up above, your hips are over your feet, your shoulders over your hips, You have this nice, natural, normal curvature of your spine. When we move to walk or run, this means our shoulders swing more naturally from this hinge rather than from here. You can even test it out. If you slouch, you can only raise your arms so far. If we're upright, you can raise your arms all the way up. Same thing with the hips. How can you have a full range of motion as easily from here as you can from here? And I love this strong, powerful running stride that we get when we're nice and tall and upright. So we need that lengthened, pliable front stabilizers of the spine to allow both that spring load of the spine as shock absorption to happen, and also the posture and alignment, freedom of motion of joints, freedom of function for the nerves, freedom pathways of the nerves so they're not getting pinched. They can get pinched more easily for here because they're coming out the front side of the low back. Lots of pictures will always show the back side, and it's a misnomer. There's so much going on in the front that needs to be addressed. So we need that length and flexibility and pliability on the front. And then think about this now more internally, more intrinsically. I don't mean physically, but like in you as a person. You know, we do need to have a strong spine, as in, you know, I think of that as holding my ground, you know, standing up for myself when I need to. It doesn't have to mean like a pushing back. It can be a staying with or a standing your ground. When people talk about boundaries or, you know, knowing who you are, being empowered in who you are and what you're about, you know, not as easily. So we need that support of self. There's that in ourselves, and then there's also universal support if you're willing to feel into that, where sometimes if you get really still and quiet, it's so funny, I get really energetic when we talk about the physical, right? Stillness always brings me back to this grounding place. We need a bit of both, right? So then if we feel into that stillness, that silence, you might just experience times where you feel like you can lean back into your chair and be supported by something bigger than you. As in, there might be a lot of problems in my life or in the world, but actually everything is okay. And actually, you know, there's a trust that my life is moving in a direction that's optimal for me. Even if it hurts, and even if it comes with all the human experiences and emotions, as it should, right? That's how we grow and develop. And, you know, I was thinking about it this week, how I think the hardships I've experienced, at least, have seemed to polish my values. Like, not harden, but polish. And that is not necessarily, you know, the natural path. It might be, it's one that takes a little more intention. And so that strong spine is the ground beneath you that you can lean back into. You can lean back into your seat or the back of your chair, which is supported by the floor, which is supported by the ground, which is supported by the earth, and the ability to take all that in and understand that, maybe feel it, maybe just have a felt sense of it. And then what's really cool, I do get excited about these things, is if you have a receptivity in your belly. My inner work path that I follow, called the Diamond Approach, is very much about the belly center, because it's a grounding center, and it is associated with the body, which is always present, as I like to say. It's you know, body's always in the moment, rather compared to our minds, which tend to like to live in the plans for the future or the memories of the past, but your body's always in the present moment. So your belly itself can help bring you back to your body, which brings you back to the present moment, which brings you back to reality. And having a softer, more open belly, as in one that's not just closing off, cutting off, resistant, rigid, And I will say I've experienced that. My athletic, very athletic minded self, my very much identified as an athlete self of the past, and sometimes, you know, a default place that comes about once in a while. It was a very hard, rigid, oh, I need to protect everything, I need to stabilize everything. That does make me feel strong, but it can be a false kind of strength, because rigidity, that hardness, can feel strong, right? But it also has a stuckness to it, right? If you I'm just tensing all like my legs and all these muscles, it has a tenseness, a tension. We talked about tension recently too. So there's a tension, a protectiveness. The way my hands are, I feel like, oh yeah, I'm ready to fight if I need to, you know, a protectiveness, resistance, pushing out. But if you just soften, you can do it right now and experience this. Just soften a little bit more and a little bit more. It can feel really scary if you're not used to it. And I have patients where when I'm releasing the front side stabilizers of the spine, sometimes there's a reflex. They're like, oh, I have to like think and tell my body to relax, because it's just such a natural reflex to fight against it. But it doesn't really help, because it's like engaging a muscle that we're trying to teach to relax. And sometimes we have to rewire our bodies and our minds, everything to know how to also relax and expand. Right? We need both. We need contraction, constriction, and we need relaxation and expanding. We need sympathetic nervous system, fight or flight or freeze when we need it, right? And we need parasympathetic nervous system, resting and digesting. Otherwise, we can't repair or recover. So same thing here. We need even in your belly, we need hardness and stability. We need to lift or carry something or carry out an exercise. It happens naturally as stabilizers and when we walk and run. But at rest, it also needs to be able to relax and expand. And if it can't, then it gets in this pattern rigidness, and it affects your posture. It affects your alignment. It pulls you forward. It pulls you inward, physically speaking. So what would it be like to be able to expand a bit more, not just in your body, maybe in your body, but also in your life? Expand, be open, be receptive. Again, it can be scary to go. There might be like 1% that you can step into this new territory, so you can check it out for yourself. But being receptive to life itself, to your own experience, your current experience, whatever that may be, means that you are impressionable. You can be impressed upon. And some of us probably don't like the sound of that. We're like, I don't want to be impressionable or impressed upon like children are, right? Be able to be influenced. But that's where that spine comes in, or that strength of the support of yourself, the strong back that you lean back into will support this softer receptivity that allows you to take in all of your experience, all of your emotions. You're human. You're meant to laugh and cry and be joyful and be angry and hateful and also not act it out to others. But understand it for yourself so that you aren't run by those emotions. You can rather be run by the truer self of you, the truer essence of you, which is your core, right? Perhaps this vertical alignment deeper within you, not necessarily a physical form, but your core, your essence. We want to live our lives from there, right? Otherwise, it's just a distorted reflection of ourselves that we're projecting out to the world, with oftentimes unconsciously, without realizing it. And then everybody else is doing this too, because it's just what we've learned and it's our conditioning, and it's also natural and normal because we develop egos as we get older from childhood on. But then we can keep growing and developing and continuing to develop as humans and as adults and as responsible and mature people in all ways, with integrity, with that strong spine and that receptive front, receptive belly, receptive expansion that's possible. The spine, the back can't really expand more, right? It's a bit more, there are articulations of the spine, as in the joints, we call those articulations, and a lot of them, but it doesn't really expand, but your front has a lot more room to move a lot, and it kind of affects the back and vice versa. And having both of those, both supports and expands your essence, your core, your true core. And I have to say, I'm much more interested in that kind of core, even as the juxtaposition to, years and years of learning and teaching about the core. But true strength of your core, of your essence, is that support surrounding it, and your ability to be flexible and open to being with your experience, to receiving what's coming in for you, to being able to receive other people's, let's say, opinions or judgments, and still have that strength and support of your spine, right? Without any need to, fight back, right? So you can have a receptivity without needing to resist or reflex. And I have to say, that's not necessarily easy. I mean, we all have our reactions and reflexes, both physically and, and emotionally in life. But the more we can become aware of all of those things, the more we can, again, not be driven by those reactions or reflexes, and not just have them happen on the, reflexively or automatically. You then can more be autonomous in how you are. Again, living from your true core, the essence of you. And physically, when we have both of those happening, the receptivity, the softer front, the supportive back, your movement can be more powerful and free. Your decisions around the movements you do and what's needed and what's not needed, and when to and when not to, especially for my athletes and runners out there. For me, I was never someone who needed to be motivated. I needed someone to help me hold back. So there's always a balance to be had, right? So we want that balance, right, of soft and hard, and not just total rigidness as a distortion or reflection of strength, because it's not true strength. True strength, as I've said in the past, includes flexibility, because it means you're able to read and maneuver and be engaged in whatever's going on. Ooh, and it just feels to me like a truer, better way to come from. So in our bodies, we want that balance. And in our lives, our souls, we want that balance too. Not so rigid. Doesn't mean we're being a puddle, just letting everything walk all over us. That's not what I'm saying. We have that strength of support that we can lean back into, and the receptivity to handle anything that comes without needing to reflex or react or get thrown off your core. So stay centered in that. Let me know how it goes. My invitation to you this week is to notice both. And just be aware. You don't have to change anything yet. Just become more aware of that strength of your back and softness of your front. Or are you really protected and rigid there? Or do you have an idea, like I did for a long time, about needing to have the flattest abs and the strongest core because that's what we see everywhere? But in doing so, perpetuating a problem that's going on in your body. Remember that rigidness, that lack of spring load, lack of shock absorption? We're much healthier when we have the ability for the spine to move. And we need it to be not rigid it's like we need the body to be like the trees that bend in the hurricane. Not snapped or uprooted. Something rigid is going to snap, right? Something flexible is going to be able to move with the wind and the movement and what comes along, the trail and the rocks or the, all the things. So pay attention to where you're rigid and where you're soft, and if you can have a balance of both. That's all I got for you guys tonight. Thank you so much for watching and listening. Please let me know your comments or questions, and of course, as always, if you have any specific issues with your body, I love helping and having a conversation about that. Let me know that you're watching and listening. Give me some likes or hearts if you're out there so I know, and let me know how it goes for you. I can't wait to hear. Thank you so much for joining me this Monday night on SuperSoul Boulder. I'm Dr. Lara Johnson from Yellow Brick Physical Therapy. Thanks, guys. And it's such a pleasure and joy to connect with you. Take care and have a great week, and I'll see you next time. Bye.